Well, Donald Trump may want to repeal and replace, but what does that really mean, and where does that leave the U.S. healthcare system? Well, joining us now from Newton, Massachusetts, is Jonathan Gruber, an economics professor at MIT and one of the architects of Obamacare, and from Baton Rouge, Louisiana, Republican Senator Dr. Bill Cassidy, who serves on the Health, Education, Labor, and Pensions Committee. Gentlemen, thanks for joining us tonight. Happy New Year to you both.
Good to be here.
To you, Doug.
Professor Gruber, let's start with you. I know that you do not want to relitigate the past with all the controversies associated with Obamacare, but you believe the law is working precisely as it was intended to do, correct?
I believe the law is working well. Any law could be working better, but I think the fundamental goals of covering the uninsured, we've covered 20 million uninsured, ending discrimination in insurance markets, not allowing insurers to discriminate against the sick, and ultimately moving towards cost control, where the cost employer-sponsored insurance, which is what most Americans have, is $3,600 below where it was projected to be at this point. Could it be better? Sure. Lots of laws can be improved.
Yeah.
Is it worth ripping it all up? Not at all.
Right. In fact, you mentioned on CNN last October some of the changes that you would like to see. You said, and I'm quoting you, "I wish the mandate penalty was stronger." The other, "I wish the federal government had done more to get states to expand their Medicaid programs." What do you mean by you want the mandate stronger? What do you mean by that precisely?
Well, basically, any insurance plan, the way insurance works is people pay in when they're healthy and they benefit when they're sick. The only way to make that work is to make sure that everyone's in when they're healthy so that the money's there when they get sick to pay out. If you have a system which does not ensure the healthy are in, then insurers will just kick the sick out and not provide them insurance. There's no alternative to that but to have an individual mandate to make sure the healthy come in the pool. Any alternative which gets rid of the mandate cannot prevent the discrimination against the sick, which is really popular among American citizens.
Senator Cassidy, you want to respond?
Well, first, for all people speak about the wonderful things about Obamacare, for 8 years the American voter has been consistently voting against politicians who support Obamacare, culminating in the election of President Trump. And it begs the question, why? If it's so wonderful, why do the voters vote against it? Because the voters are sick of people in Washington, D.C. telling them how to live their lives. They just are. And they think this gives way too much power to Washington, taking it away from the individual and from her family and from the state. As regards how do you cover other people, the Republican plan isn't a mandate with a penalty. It is that you give states the option that those eligible would be enrolled unless they choose not to be. When people turn 65, they go into Medicare. They don't say, oh my gosh, there's a mandate, I'm on Medicare. They say, I'm enrolled in Medicare. So the Republican alternatives would say, states, you can decide if someone's eligible that they would be enrolled unless they choose not to be. You make it really easy to get out, but otherwise you're enrolled. And that way you restore the law of big numbers. All those young, healthy people are actually in to help spread out the cost of those very expensive illnesses.
What we're hearing from Mr. Trump, Senator Cassidy, is few and far between, very sparse in terms of details. It's not exactly what we're hearing from the House or from the Senate about repealing and replacing. What precisely is the time frame for repealing and replacing, and what precisely do you replace it with at this point? And to that point, aren't you kind of boxed in by Obamacare? As Professor Gruber would say, you've got 20 newly insured people. How do you get rid of that?
First, I think we know the President-elect's instincts. It is for market-based reforms. That's number one. Number two, I'm a physician. I've been working for 30 years in a hospital for the uninsured. And so I take as the person I look at as that woman. She voted for Trump. She hates Obamacare, but she's got a breast lump. And she needs to make sure that in this transition, her breast lump, her cancer is cared for. As long as we keep her as the prism through which we examine this problem, I think we'll do okay. And what can we do to help her but to transition to something more market-oriented? I believe in price transparency. If she's going to get a CT scan ordered of her breast, then she should know the cost of that CT scan before she has it done to allow her to comparison shop. If you introduce that, you actually lower cost, you give her the power. She has the power of choosing based on quality and cost, and in so doing, you expand her ability to influence her care much more so than Obamacare did.
Professor Gruber, he makes a good point about this choice, something which seems to be neglected in Obamacare.
You know, I'm afraid the senator's providing the same garbage salad of empty talking points that we've heard from Republicans for years. Let's just take one simple example, price transparency. There have now been dozens of studies of price transparency, credible scientific studies. Not a single study has found that price transparency lowers costs or improves healthcare quality. Could it? Sure, it could. Many things could be true. But once again, the question for Republicans is, where's the fire? We have a law that is working to provide insurance coverage for 20 million people. They want to take it away without a credible alternative. They have no alternative. They have no proposal that has been vetted by the Congressional Budget Office and scored.
Senator, go ahead.
Well, yeah, it's not been scored, but I've actually introduced 2 pieces of legislation that would address this. And the studies looking at price transparency looked at like $50,000 operations. If you look at that which is most apparent, plastic surgery and LASIK surgery, where there's price transparency, people advertise on bulletin boards, on street signs. Those have actually decreased in cost over the last 10 years. So where you make it immediate, and where you make it where the person understands, give the power to the patient. Obamacare took power from her. Republicans think she should have the power. I don't know why there's such resistance on the left to that, but if we give the patient the power, good things happen. I saw that in my practice. I see it in life.
Professor Gruber, you often make the point, and many people on your side of this debate make the point that you've got these 20 million newly insured, but you never delve into the quality of the care they're getting or that they might get. And USA Today reported on May 4th of 2015, a little over a year ago, and I'm quoting here, 3/4 of emergency physicians say they've seen ER patient visits surge since Obamacare took effect, just the opposite of what many expected would happen. Why are people still going to the emergency room when they've got this comprehensive care that you're touting?
Well, first of all, remember with Obamacare, we've run the experiment once. We ran it in Massachusetts. So we've got sort of a 5-year head start in studying what happens. What happened in Massachusetts is initially emergency room visits did go up because people suddenly had more access to the system. But over a few years, as people got used to having insurance, they went down. The same thing's going to happen nationally. And the main thing to understand is that if you look at the quality of insurance that people have in the market, before Obamacare, you could, for example, have an insurance policy which said, we'll cover your first $10,000. After that, you're on your own. That's not insurance. Obamacare ended that. Okay, and many Republicans have said, well, they like ending that. They like moving to real insurance. The point is, how do we move to real insurance? How do we bring the sick into the system without having the healthy in the system? And there is no evidence that purely market-based policies are going to work. Look, I'm an economist. I'm for market-based solutions to problems when there's some evidence they work. There's no evidence it works here.
Senator Cassidy, I'll let you respond with the last word here.
It's kind of amusing to hear the professor criticize policies with $10,000 deductibles. The typical bronze level of policy has a $6,000 deductible. That's an insurance plan that works. A friend of mine, no one believes me, so I put it on my Facebook page. He got his quote. He and his wife, 61, 62. Their policy is $39,000 a year, and they have $6,000 deductibles. Now, if this is a policy that works, I'd hate to see one that does not. And we indeed actually do know things at lower cost. Health savings accounts have been proved, academic studies, that when someone has a health savings account, she becomes activated, more aware of cost. If you combine that with her actually having the ability to know the cost, she receives the care she needs, but at a lower cost to both her and to society.
Gentlemen,
this is academic research. The professor's a little bit wrong on that.
All right, gentlemen, this is a conversation and a debate which is going to escalate in the coming months. We'll be hearing from both of you, I have no doubt. Thank you very much. Good to see you. Appreciate your time.